Although most of our viewing area fared okay from Tropical Storm Elsa, it's a great reminder that hurricane season is upon us and severe weather can be the culprit for many injuries. Dr. Michael Boniface, an emergency medical physician with Mayo Clinic, is joining us now to talk all about hurricane prep. Doctor, thank you so much for being with us this morning.
Great. Thank you for having me. It's my pleasure.
First, let's talk about emergency kits. We all know about the batteries, water, canned goods, and those kinds of things when it comes to prepping before severe weather hits. But is there something that people tend to forget or maybe overlook when it comes to health and safety?
Absolutely. I think that's a fantastic question. And this is probably the one thing most of us who live in Florida are familiar with as far as preparing for a storm. And for years, we've carried, batteries, flashlights, ponchos, things like that. But what I find commonly that people tend not to think about are those related to personal health, hygiene, and safety. So particularly medications are often forgotten, and it's not uncommon that every season we'll see folks in our emergency department because they have evacuated perhaps from South Florida and need a refill of their medications. So I strongly recommend not only keeping a list of your medications for yourself and your family members, but also at least a 72-hour supply in your emergency kit. I would caution, though, that if those medications include anything that is potentially dangerous, sedating, or you don't want it to have in the hands of children, you need to keep it safe and locked up so that they can't get into it in the kit.
That is such a good and important reminder when it comes to things like these hurricanes that we're talking about, but also the tornadoes that come along with hurricanes oftentimes, like we saw this past week, or other side effects from Mother Nature that is destructive. What do you remind people when it comes to that temptation of maybe wanting to go outside, take a picture, get a video, going to survey the damage? What is your message to people about being safe when they're thinking about venturing outside?
Sure. I mean, I totally understand the temptation to get outside during and immediately following a storm. The awe of Mother Nature is really something to behold. But you have to understand that immediately afterwards, it's not automatically safe. Flood waters have not receded, and you don't know what's going to be underneath there. It could be sharp debris that you could step on and injure yourself. It could be live electrical wires. As we've seen, unfortunately, during this past storm, the sogginess of the soil can lend to instability of other trees and structures that can be tenuous and fall during and afterwards.
What are some of the most common injuries that you guys do see during hurricane season, and how can they be avoided?
So during the hurricanes themselves, it's actually rather slow in the hospital, as one would expect, but we do see a surge afterwards. And the majority of this tends to be from the survey of storm damage and cleanup. It can be a lot of what you expect, which is, injuries, stepping on debris, moving things, but also accidental self-inflicted injuries are probably the most common. People using chainsaws, axes, who maybe aren't used to it, the sort of weekend warrior DIY folks. And, you should do whatever you feel comfortable with, but do it safely. The other thing I would recommend is we see a lot of injuries from folks falling off of ladders, trying to get up onto other levels or stories of their house.
And regardless of the severe weather, we do want to point out that it's summertime in Florida. It's pretty hot outside. What is your advice regarding the increasing heat that we are seeing in our area and staying cool and hydrated?
Sure. So, I mean, it's Florida. Everybody loves being outside, enjoying the sunshine and going to the beach. But there's a way to do this safely and always in moderation. Probably the biggest things I can recommend are protecting yourself with clothing that's SPF rated. We see that on these tags now. Applying sunscreen, staying extremely well hydrated, staying in shady areas when you can, and taking a break at the first sign that you are feeling tired. You hear a lot of terms out there, heat illness, heat cramps, heat stroke. There's almost 10 different definitions for various heat-related illnesses. But really the most important thing to remember is that if you start feeling poorly in any way, including feeling very tired, you need to remove yourself from that environment, ideally find some air conditioning, stay hydrated, and recover. Furthermore, if you experience severe symptoms of heat-related illness, including difficulty breathing, confusion, stroke-like symptoms, chest pain, you need to call 911 immediately.
Dr. Boniface, thank you so much. All very good and important information as we head into the rest of hurricane season.
Absolutely. Thank you. You have a great weekend.